You feel that's different?
For me, it was a good sign that, like, last time I told you I played, it completely froze and I couldn't turn after. So I feel like there's just a little bit of pain, the regular amount of pain after.
Okay, not in like increased amount.
No.
Okay, that's good. Let's take the flip flops off. Let's check your static posture, and we'll keep going. You gonna do some hops for me? Okay, and relax. Check here. Okay, so arm length is good. This is good too. Hip, raise the arms. Here we're gonna check rotation. So there's a bit of a rotation up here. So there's something upper body, right shoulder. Okay, line your back. Let's check. Just move the table a bit. So we'll just recheck glutes from last time. Push down, we'll see if it's activating. Push down again. Push, push, push. That's good. Push down. Okay, so stronger on the left. Push down with the foot, where my hand is. Oops. Then over here. Push down. Okay, so it's failing when we push from the forefoot. From the heel, you're okay. Push down. Push, push, push. This is fine. Push from here. Everything we do is pushing off the forefoot though, right? Every release. Same thing. You're swinging right or left?
Right.
You're right? Okay. Interesting. Let's check hamstrings. Pull towards you. Pull, 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 pull. See your ABCs?
A-B.
This is good. Pull towards you. ABCs.
A-B.
Let's check the glutes from this point here. Push down from here. Push, push, push. Seems okay. Push again. ABCs.
A-B-C.
Relax this foot. Push down.
A-B-C.
Yeah. Okay, perfect. So there's something else shutting off the right glute right now. Right now, do you feel pain at your neck or anywhere? Tension? Any noise anywhere?
Not really.
Not really. Okay, let's check something here. Any sensitivity when I push here?
A little bit.
Keep your hand here for me. You don't need to press, you just need to place. Push down from here. Okay, now it's better. Push down. Okay, so your blockage is up here. Sorry. Sensitive?
Mm-hmm.
Okay, so we're gonna release this after, but we know that this is linked to the glute. So it's just the spinous ligament at the cervical spine.
Mm-hmm. Yeah, that's
The nuchal ligament.
tender.
Yeah, it's tender, so it's stable. It's almost like staying on tension, staying taut to help your hip extension pattern. Push both feet down. Okay. Push this one down. Yeah, and this one you're lacking a bit. Push down. So you're fine. Put your hand back at the neck. Push down with the foot. Yeah, reactivates right away. Okay, so that's gonna be the plan for your neck on that side. Okay, let's just check quads. Hold here. Push up. Push, push, push. How are your forearms?
Good.
Yeah, they're not as tensed?
Not.
Okay, push. So I know that was an issue last time. Let's check hip flexors. Pull towards you. Pull, pull, pull. Good. Here, pull towards you. Remind me when you're leaping?
Early November.
Okay. And did you go to any courses since last week, or just the driving range?
Just the ring.
Just the range? Okay.
Okay.
This is okay. Bend both knees. Push down. So now we're just checking if there's any stimuli, push down, that will provoke any weakness on the body. Push down right here. Oh, you find this. Let's check neck compression. Push the arm down. So you're still getting a bit of neck compression every time we, so for example, push down right here, push, 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 super strong. As soon as we add pressure to your head, push down, body doesn't like it, you go weak. So let's see where that compression is coming from. Push, down, sorry, yeah. Okay, so we've got an adhesion somewhere. It's at the trap, push. 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 Right here. Sensitive?
Yeah.
A
Yeah.
little bit.
Yeah.
Okay, so we got the ligament here in the back. We've got the trap to release. That's gonna help with the neck compression. Let's see what else we got. Push down. Push down. This is fine too. Okay, let's continue testing here. Push out with the legs. Push, push, push. Okay, good. Pull this leg in towards the middle. Same thing here, pull towards the middle. Pull up. Push everything to your right. Good. Push again. Say your ABCs. Okay, good. Push everything to your left. Okay. Push again. Okay, so that's the quadratus lumborum QL muscle right at the low back on the left side. Tell me if this is sore. Not too bad.
A little. Yeah.
This one too?
Yeah.
Here?
Yeah.
Here?
No.
Okay, let's compare. Here?
No. Nothing.
Anything here?
Yeah.
Anything here?
A little bit.
So usually the front of the pelvis will start to tighten up when whether the adductors, the abductors, or the QL are offline, and you'll become sensitive. Okay, there's tension here.
Yeah.
Sore there. Okay, just let me know if it's too much, but we are going to release right in here. What range were you at? Where you usually go? Oh, Kirkland? Okay.
Yeah.
Wait,
Actually,
Kirkland, is that the
really-
dome? No, no, it's
Kirkland?
not open.
No,
No.
it closed.
Yeah,
Yeah.
so what's the Kirkland range?
Do they have a range? I don't know.
So why'd you say Kirkland?
Kirkland.
Oh no, I asked
Griffin.
which range you go to.
Griffin.
Oh, Griffin.
Yeah.
Okay.
My course. I was hitting really well actually. Like really good. As if I've been playing every day.
Okay. Nice. Do you use any like tracking systems to check your distances and stuff?
Yeah.
Okay.
Which one?
Rap soda.
And which of it?
To track my distances.
Rangefinder.
Oh, Mousy.
And those, what are they, subscription based?
The rap soda, yeah.
Really, eh?
Yeah.
And what is it, just to get updates or just so you keep your scores on the cloud?
No,
What is it?
that one's more to like you can play courses. It's like an outdoor simulator.
Oh, okay.
Yeah. You can play courses on the range.
Okay, cool.
Yeah.
And so what, you set it up behind you?
Mm-hmm.
Okay, so it's similar to all the indoor. Really, eh?
Yeah.
That's crazy. So it's just move this here. Tell me if this is sore. Not too bad.
A little. Not too bad. Yeah.
I can't remember. There's a bar. They have the most indoor simulators right now. Is it the Scratch?
Yeah.
You know, it's that one, eh?
Mhm. You've been there?
Long time ago. Not since they updated all that stuff. You know, adding in.
Mm-hmm.
But I heard it was like a guy from China that came in and just set them all up.
Oh, okay. It's good business.
But I don't know how much one simulator costs.
Sure.
Unless you do.
No.
Oh.
But they definitely make it back.
How much is it like for a round usually?
I think it's 40 an hour.
Oh really? Okay.
Yeah.
Wow, so sometimes it could be more expensive than
Yeah.
doing a real range. Unless it's a lot, well I guess because there's less walking, so
Yeah.
it's not gonna take you 4 hours to do an 18, but
And people can share, like it's just one stone.
okay.
if you have a foursome, you share the 40 an hour.
Yeah, it's true. You're right. No, it's cheaper then. Push everything to your left. So your BCs.
A, B.
Okay. Okay. Let's go in a seated position. We'll face this way. Just gonna lower this a bit. We're gonna use a bit of the shock wave right on this point here. If you want your legs hanging, maybe it'll be more comfy. Alright. And are people?
I could.
Okay, so as soon as you post a story, people ask you for lessons.
Yeah, I got like, because I don't really teach anymore.
Okay.
I got like 400 DMs when I opened
Oh my god. Who's managing that for you?
the. Me.
Bring the head down a bit. Just make sure we're at the right. Okay, so not more than 5, 6 out of 10 pain.
Okay.
Okay, let me know if it's too much. Sensitive or all good?
A little sensitive. I think it's me.
Okay, we'll leave it on this for now. With your two hands, you're going to put pressure on your head. You're going to pull down, almost like you're stretching your neck.
Oh.
Put yourself on a stretch. Yeah. Keep stretching. Keep pulling down. You okay?
Yeah, now it's at 6.
Okay, so we're right at the limit. If you can't handle it, you can take pressure a bit off your head. But yeah, we're putting the ligament on a stretch because it's the best way to release it with the sound waves.
Ooh, yeah.
But yeah, you got built up adhesion and inflammation right in here. So everything's connected, right? It could be a ligament, another muscle, it could be a joint compressing, anything to try and add stability into your body if there's a weakness somewhere. So what we've been finding even from the last session and today is like the posterior chain, right? So the glutes. Today we still got a bit of glutes, but only from certain angles, right? So when we just push off the forefoot.
So,
Anything over here?
yeah.
You can come closer if you want. That's good. What's the pain out of 10 right now?
5.
5? Okay. We're almost there. Take deep breaths. Push this one down, sorry. Yeah, okay, much better than this. Push down. Yeah, solid here. Say your ABCs.
A, B, C.
It's not budging. Okay, amazing. Push both feet down for me. Yeah, okay. Good. Okay, next is going to be this trap here. So, best way to release this, we're going to send some sound waves in here now. Okay, do you mind taking the shirt off? It'll be... So you're going to grab the table here. You're going to side bend and bring the head down a bit, just like that. You okay like that?
Mm-hmm.
Okay. Let me know what you feel here. Woo! Sorry. What do we got?
Wow.
What's the pain out of 10? Like more than 5, 6?
It's good. That's a 6.
What do we got?
6, 7.
Okay, it's okay. I'm just gonna put more gel. It's gonna
Whoa.
dampen goodness, sounds. Well, that trap's been.
Shit.
So that trap's tight. It's reacting to the neck compression. Is that better or
Yeah.
sure? Bring your head to the side again. Yeah. Is it more than 6 out of 10?
No, that's a 5.
Okay, good. Yeah, so sometimes you can put more gel to distance a bit the tip. Make it more tolerable. Where's the worst spot here?
I feel it all down my back.
Oh, it's going down your back.
Yeah.
Okay, so that's a good sign.
Okay.
That means we're treating different areas at the same time. Referred pain is usually a good sign. Are you feeling it at your trap though? Or just
Yeah,
going
yeah.
up? Yeah.
Yeah.
What's the pain now out of 10?
5.
5. If I bring it more here,
Now shoulder and
sort of shoulder. Yeah.
lat.
Okay. Been locked for a while.
It's just that track, because I thought it was the other track.
So you got more tension on the left side usually.
Yeah.
So we'll see if the left side decreases in tension after releasing this one.
Okay.
Anything here?
Yeah.
This. Actually, we gotta do the opposite. Push out with this arm. Okay, good. Push out. Okay, good. What do you feel on this side?
Not much.
Not much on the left. Go, turn your neck each way. Just tell me what you feel.
Just some tension here.
No tension there. Okay. Bring your head down. Anything with this?
Yeah.
I'll do the neck that way. Okay. Relax. Extend back. Look up to the ceiling. Anything this?
This
There's a trap now. Okay. Relax. Do a side bend, ear to shoulder. Okay. How's that one? More of the trap. Sore here?
Yeah.
Sore here?
Not
Not as much. So scapular nerve. Okay, let's get you on your stomach. Let's continue here. Sensitive or it feels okay?
sensitive.
Too much?
No.
Okay, let me know. So we'll see if releasing rhomboid and part of that scapular nerve is going to help with the neck. Just looking for anything that's tight along that line.
Mm-hmm.
Yeah, I can't imagine getting the number of DMs that you are. I feel so overwhelmed.
Right.
Like, I'm like, isn't there a program that could answer for you?
Probably.
Like automate? Yeah. Okay.
Probably. Gotta look into it.
Need a personal assistant,
Yeah.
you know, overseas or something.
Yeah.
And what's the age range that you'll teach?
It's between 4 and 80.
There's 4-year-olds.
Yeah.
That's crazy. And what, they play golf like all summer?
The 4-year-old?
Yeah.
Yep.
Oh my god. And are they're actually decent? Like they,
No.
or is it all like coordination and it's working on that, like
Yeah, it's just hitting
just hitting, making contact?
it. Yeah. I actually don't recommend getting lessons for kids that young. They just need to hit plastic clubs.
Yeah, yeah. I guess some parents are just they're living a dream through their children or something, like they're.
Yeah.
Well, hopefully they're playing other sports in the year or getting other types of movements.
Yeah.
So what's the minimum age you recommend?
Probably like 8.
8? Okay.
Yeah.
Just going along the skin, just for anything on the superficial surface of the fascia, if there's anything. Doesn't hurt, you're okay?
No.
Okay, good. And what about the 80-year-olds? Are you able to get some improvements from them?
Yeah, a little bit. Also hard for me. Yeah, to work with limited mobility.
Ah. So usually are they doing like personal training or like any type of
I
exercise
recommend-
classes to
yeah,
usually
I
recommend
that.
working on mobility? Usually that's what I tell my golfers. It's like the best investment is actually working on your body, right? And trying to open up things instead of trying to force a technique where, you know, where things are blocked no matter what.
Yep.
Or actually you should be doing both, I think.
Yeah. You get a lot of golfers?
Quite a bit. Yeah.
What's the most common problem? Elbow?
Honestly, it's either knee, hip.
Really?
There's been quite a few actually this summer. Like with that rotation, right? Off a hip and stuff. But also that comes with age, right? So if, you know, they're over 50, they're getting, the younger ones, shoulder, and I've had one neck. So that's, I guess, yeah, when you're young, is that what you see too?
Yeah.
Usually the younger ones have, the younger age golfers, it's more neck and shoulders.
Yeah.
Yeah, or elbow. Okay. We're gonna do a bit of shockwave. We're gonna go back to seated position. Let me know what you feel. Sensitive?
Yeah.
What's the thing out of 10?
5.
5? Okay. Down here?
4.
Down here?
5.
5. Okay. I'm just gonna run it all through here.
Ooh. Yeah. Wait.
Yeah, so as soon as we put a bit more on the stretch, you seem to get it.
7.
Okay, sorry. Just gonna keep it down in this range then. And so what's happening in Texas is just regular routine. You're training people and playing.
No, I'm not. I don't really coach anymore. I just
Okay.
did it because I couldn't play. That's
Okay.
something to do.
Okay, so your plan is not to continue coaching.
No. That's why I don't really, the DM thing isn't really a problem. It's just a problem for that week. So I'm just gonna be training there, playing.
Unless you hire someone under you, you know, and
True.
you kind of tell them, hey, this is how I coach. This is how I want you to coach everyone that messages me.
Yeah.
You know, that's kind of like what I've learned to do. Just think everything I don't want to do, I just delegate it.
Right.
You know, and that's it.
In this case,
Kind of hard when people want to work with you, you know.
Yeah.
But okay, so in Texas, you're doing tournaments. That's the goal.
Yeah. Tournaments and training for tournaments. I didn't really play, like, seriously all summer. Just focus on content.
Okay. So the goal for Texas is to play serious.
Yeah.
people who want to Texas to play golf. I don't know why, but I guess there's quite a bit.
I guess. I mean, it's warm and I have free stay there, so
Okay.
good for me.
Cool. What's our payment?
6.
6 still, eh? Okay, let's recheck the neck. You're gonna lie back on your back. And let's see what happened here. Set. Okay, good. Push down. Okay, good. So that's not weakening. Okay, back on your stomach. Let's check back of the pelvis here. Tell me if this is sore.
No.
Okay, good. Anything here?
Yeah.
Yeah? Okay. Anything here?
A little bit.
A little bit. So, then keep the knees together. Then here. So you got the left shin a touch higher. So I'm just gonna
Higher?
Yeah,
Like it's longer?
it's longer, yeah. So if we bend here, you got this one higher. If I have my hands equal. But you can see a bit of a shift at the pelvis, it's a bit this way. So, let's see what happens. Said here was sore?
Yeah, a little bit.
Okay, again, let me know if it's too much. We're gonna release in here. And your parents are going with you to Texas, or just you?
No, just me.
Just you, okay. And when's the return date?
Probably end of May.
Okay, wow.
It's warm.
You're really, okay.
Yeah. Don't like the cold.
Yeah, yeah. I gotcha. Although our cold, I find really just starts in December now, but.
Yeah. I mean,
Well, unless cold to you is like anything
Cold.
under 20 or
under
18?
20, yeah.
Okay.
For golf especially.
To me, cold is like under 5.
Oh, okay.
Then it starts getting a bit, but that's still t-shirt weather for us.
That's crazy.
Just gonna shockwave them in here. A little bit sore.
Yeah, a little bit.
Okay. Is it gonna be your first time going to Texas?
Yeah.
Oh, okay. And do the courses usually like invite you, or you have to?
I'm starting to contact them now.
Okay. Anything here?
A little bit.
A little bit. Unless you get Marlon to coach them. All those DMs.
Mm.
No?
No.
Okay.
So he's got DMs, I got emails.
Okay. And I can't remember if you told me you're using any AI software for the editing, or you're just doing it all manually.
Manually. Which is a pain.
Look into Veed.
Oh, for
VED.
I have that.
You have it?
captions?
Whichever. Well, it'll cut videos for you, right?
It
I
does?
think. Yeah.
Oh, I didn't know
Yeah, you can use the AI component there, and
that. I was just
it'll
using
take like
it
a
for
30-minute
captions.
video and make it into clips, right?
Oh,
Things like
okay.
that.
Okay, I didn't know it did that.
That's the one we use here, but. Let's check what that is. That's better. So now it's equal. Okay, good. Let's go back to seated position. Let's recheck those neck motions. Let's see what we're doing here. Just go through all, let's try flexion.
Yeah,
Still
less.
tight. Less?
Less,
Okay.
yeah.
Yeah, ideally you should be able to touch your chin to your sternum.
Oh, yeah, no.
That's not happening. Not right now. But yeah, that's all built up tension, all from even the spinal cord. Do you feel it pulling down your back?
Yep.
Do you ever do this stretch though? Like just going down and breathing? Ever try that one or no?
No.
So all you do is gentle pressing. You just hold it here. Just breathe. Breathe from the belly, and as you exhale, you can go, a little further down. But you want it to pull all the way. Is it going down to the low back or just like?
It's not going all the way down.
Okay,
I feel
it's
it
just
more
staying
on
at the neck.
Yeah,
No pain though.
a little.
A little bit of pain. Okay, so I wouldn't do it.
Okay.
There should never be any pain with like
Okay,
a
just
stretch.
stretching.
Even an exercise, there shouldn't be pain.
Really?
So you're getting pain where?
Yeah.
Yeah. And what is it out of 10?
Okay, 4.
Yeah, too much. If it was like a 1, like a discomfort, okay, you can push a bit, but 4 is too much. But, okay, so we still got some blockages here, but it's okay. Go through extension. Tell me what you feel.
Yeah, it just feels like a stretch.
Okay, so that's good. I want to improve. Try side bending your shoulder.
So here.
Stretching down, all in the traps in there. What's the last one? Rotation.
A little bit in the back.
So that trap, we're gonna keep hitting it every single session. It's almost like we're gonna keep breaking it down until you don't feel anything when you rotate your neck.
Right. That was the most tender, right? That was-
Yeah, for sure. The right side. So pinch together, pinky and thumb. Just want to make sure your grip strength is good. Okay, good. Push both arms out. Okay, good. Push out. Yeah, no, this is good too. I can't remember. You have a massage gun at home?
No.
Or no? Nothing? Okay.
Should be on.
You could, but you can also use a ball, like whatever works. But so lie on your back for me. I'm going to show you where the new points are. Continue the glute points from the previous session, but with your bridge, knee like this, raise up your heel 1 inch. Okay, it's going to be a bit awkward on the table, and I'll just lift halfway. And I'll just hold that and breathe. Where's the tension?
Like that.
Calf? Okay. Just relax this. Let's bring this a little closer. Try again.
Good.
Okay. So you always have to modify the position where we want it to work, right? So if it was a bit further out and you only feel your calf, I'd rather you feel glute than a hamstring.
Right.
So just bring the foot closer to you, right? So I mean, that's the same thing when you're exercising. You always have to know, 1, there's no pain. That's the most important thing. 2 is where are you feeling it? Or are you feeling where you're supposed to, right? So that's where you shift your foot or whatever you need to do,
Right.
So in this case, it's just bringing it a bit closer, and that way you get the glute.
Right.
So do the jaw, do behind the neck, and then just do a mid-foot bridge hold. You know,
Okay.
like 10 breaths, 15 breaths, but anyways, I'll send that to you by email, the
Okay.
pictures. But your new homework is gonna be for this QL. So what I want you to do with the ball is you're gonna release all in here.
Yeah.
Usually I use a door frame. So I'll put the ball here and I'll go into a door frame. That way the leg can clear. I don't know if that makes sense.
Yeah.
So you just want to push that ball into here, and release middle of the sacrum.
Okay.
right in here. That you can just go up against the wall.
Okay.
Okay. For the QL, it's part of the lateral chain, so you can literally just do a side plank to activate it.
Okay.
So let's try that. So have your head on this side and you go into a side plank. And you can stay on your elbow and you can even stay on your knees because we're just activating at the end. Okay, come back down. When you're side planking, go into a hinge forward. So let's say like I'm like this. Right now this is your position. Bring your pelvis forward. There you go. That way you're not lifting straight up instead. Pull this elbow towards your hip. So you're adding tension.
Okay.
Breathe. This you can bring up if you want. Keep breathing. See, so now it's shaking because now you're adding tension into the motion. Are you feeling it all through here?
Yep.
Okay, good. You can make it a little tough, a little harder. You can abduct a bit, but 5 to 10 breaths. It's just to activate. Okay?
Yep.
You can relax. Always do both sides.
Okay.
Okay? So release, release. Go into a side plank. 5 quick breaths. It's done. Okay?
Okay.
So glutes, lower lumbar. Okay?
Yep.
This one for sure you can keep trying, but if there's pain, I wouldn't do it. So
Okay.
try it if you daily,
Mm-hmm.
but the goal is to get a nice stretch, like a pull, no pain at all.
Yeah.
Okay? So start releasing that a bit more, but for sure now we're heading more into lats and upper body muscles, like for next time.
Mm-hmm.
So and we're gonna shockwave more the neck, things like that.
Yeah.
But that's the goal. So
Perfect.
hopefully by the next session, like neck motions will start improving even more.
Cool.
Okay? Do you have any questions for me?
Can I try the arm thing that I didn't get to try last time?
Yeah, for sure. We can put you on the normal tech because you got time now, right? So you're
Yeah.
not in a rush.
Yeah.
Yeah, for sure. You can put your shirt on there and I'll bring you. After that, it should go to heat.
Okay.
Let's say you're in chronic pain or you have pain for longer than a month. You can ice, but only when the pain is provoked. So let's say like your average pain is like 5 out of 10. All of a sudden you did something or whatever, or that day for whatever reason, it goes to like 7, 8, 9 out of 10 pain. Usually I'll say, okay, put ice, try to like desensitize the receptors, right? Because that's all it is. It's a change in perception, right, from the ice. But usually it's always heat. Anything chronic pain or after 48 hours of an injury, I always heat now. So it's to increase circulation, you put heat, you compress, you move, you can elevate the limb. All that is to help with swelling and stuff.
Good.
Okay?
Yeah.
So the people that are always icing like every day, I don't know. I'd rather they be heating, honestly.
Okay.
But some people, let's say there's like a neck injury, for some reason, sometimes heating will make things worse and ice will be better. That's the only thing I've noticed where like people really tell me like, hey, I tried heating and it's making my neck worse. Okay? Other things going on. That's like different than what an extremity would give you.
Right.
So individually, you got to be aware of what
so you have
works
to-
for you.
Yeah, like I said, so you see how you react to different things because you could put heat, and I've had people where they say my neck stiffened up after putting heat. It's almost like that rush of like inflammation that's circulating. It's like blocking other things. Some people they say, hey, I put ice on my neck and like it stiffened everything. I didn't like it, right? So that's why I always say always default to heat first, and
Because I've heard all of these different therapy scenarios as literally control injuries. Like you were saying, when you get injured, it's ice. But this is like a controlled injury to like get things back in order, but you're still breaking up like tissue and stuff like that. So I've always been told, even when you after the session, do a little bit of ice, and then the next day do heat.